Hello, my name is Sony Bishop, and this is my presentation on infertility. What is infertility? Infertility is defined as not being able to get pregnant while having unprotected sex for 1 year or longer. The risk for getting infertility for women is excessive alcohol use and smoking, endometriosis, pelvic inflammatory disease, sexual transmitted diseases, and extreme weight gain or loss. For men, it is being over the age of 40, excessive alcohol and drug use, smoking, exposure to radiation and environmental toxins, and the testes being frequently exposed to high temperatures. Now, what are the causes of infertility? For women, is usually the dysfunctioning of the ovaries, fallopian tubes, and or the uterus. Anovulation is when a woman doesn't ovulate during the menstrual cycle. Anovulation can be caused by polycystic ovary syndrome or PCOS, diminished ovarian reserve, DOR, premature ovarian insufficiency, POI, and or menopause. PCOS is the most common cause of infertility according to the CDC. Due to this condition causing women not to ovulate or ovulate regularly. DOR is when a woman is born with the eggs that they will ever have and it declines naturally over time. POI is when a woman's ovaries fail before the age of 40 and is also considered as premature menopause. Now for the fallopian tubes, if they are open, blocked, or swollen, this can also cause infertility. The main causes of infertility in men is the shape, motility, and the number of sperm. Varicocele is a condition when the veins in a man's testes are enlarged and affecting the shape and number of sperm. Another cause of infertility is trauma to the testes, cancer treatment or surgery to the testes, which can also disrupt the testicular and ejaculatory function. What are the misconceptions about infertility? One misconception is that when you are infertile, it means you can never have a child, which isn't true because there are infertility options like artificial insemination and in vitro fertilization that couples have used and had children. Another misconception is that women cannot get pregnant after the age of 35 due to their maternal age decline. But according to Bowman, only 1 in 6 women over the age of 35 have infertility problems. Using the birth control pill can cause infertility is another misconception because a woman's menstrual cycle continues as usual after not taking the pill. A common misconception is that infertility is the woman's fault, but according to National Institute of Health, 1/3 of infertility is caused by male issues, another third by female issues, and the last third by both. Stigma around infertility is reinforced when someone is labeled as infertile, the negative views of the perceived causes of infertility and the consequences of infertility. For women, the stigma around infertility makes them feel like a failure or useless because they cannot be a mother. For men, the stigma around infertility makes their masculinity feel questioned or threatened. Misconceptions about infertility also add on to the stigma around it. For example, the use of contraception is used as a cause of infertility, which leads to people not using contraception. As stated before, if a woman stops using the pill, their menstrual cycle should return as normal. But how does infertility affect someone individually and their partner? Infertility causes distress on someone, and that can lead to anxiety, depression, and lower self-esteem. Couples may feel a loss of control, shock, and frustration. Couples may also feel social pressure from their friends and family, which in turn furthers their distress. Infertility treatments themselves also have side effects that affect women psychologically. According to researchers, infertility medication side effects include anxiety, depression, irritability, and mood swings. Now, the development of infertility treatment. Artificial insemination development began in 1779 Italy by Lazzaro Spallanzani when it was established that sperm and egg must make contact for the embryo to develop. Spallanzani then successfully inseminated dogs. In the late 1770s, the first success attempt of artificial insemination on a woman was documented by a Scottish surgeon, John Hunter. In 1909, donor insemination began to gain popularity. The popularity of artificial insemination started the development of other assisted reproductive technology, or ART. As the role of hormones in reproduction were examined, it led to synthetic hormone use in the 1940s. For in vitro fertilization, IVF, its earliest attempts are in 1890 by Professor Walter Heap trying embryo transplantation in rabbits. The first successful IVF performed by Robert G. Edwards and Patrick Steptoe when Louise Joy Brown was born on July 25th, 1978, aka the first test tube baby. Ethical issues surrounding infertility. Now, many people have multiple views on infertility and its treatments. This could be because of how they are raised, values, or religious beliefs. For example, the Catholic Church declared that infertility treatments like in vitro fertilization (IVF) is an unworthy way to conceive a child. Another reason why they don't support IVF is because stored embryos are discarded. Another ethical issue is about the stored eggs, sperm, and embryos. There are conversations about scenarios when a partner dies or when a partner leaves. Is it fair for the remaining partner to use the embryo? This brings up informed consent and who owns the embryo and have the right to decide. Now, my question for you is, what are some ways the topic of infertility can be normalized so that it can further eliminate the stigma around infertility? This is the end of my presentation. Thank you for listening.